Hello, thank you for joining us and welcome. My name is David Seda, and I will be your moderator for this discussion. We're very pleased to have with us Kieran Murphy, President and Chief Executive Officer, GE Healthcare, and GE's Chief Digital Officer and Vice President, Amit Padnis. We want to touch on three themes in the next 15 minutes. The acceleration of digital in the era of COVID, particularly the virtualization of care, the convergence of clinical medicine and data science and what it means for the future, and lastly, enterprise-wide or network-wide surveillance to manage capacity and patient journeys. Thank you both for joining us. With that, Kieran, I'd like to give you the first question on virtualization. The foundation technologies for virtual care were already available and even in use to some degree. But the pandemic created this use case where virtual care became all but mandatory. What are your observations now as you look into the future of virtual care?
Look, before COVID-19, we did see this rise in the availability of the technology and, of course, rising consumer expectations for convenience and expediency. And, of course, that's now been heightened. And I think if we take virtual visits as an example, it gave everybody an opportunity to get access to health, but also to stay safe. They were able to do it from their homes. It was very convenient. And, so I think from that point of view, it's been terrific. And of course, from a hospital point of view, there was a huge need to keep their staff safe. And so, like all the rest of us, they were able to allow their people to work remotely, and for radiologists, for example, to read exams from their home, and other clinicians to interact and do telemedicine. And so I think one of the biggest impacts of virtual care is to scale scarce resources effectively. And if I use an example, in India, we had a tele-ICU system set up where we were able to connect 800 beds and enable remote monitoring for critically ill patients across the country. And the chief intensivist who was dealing with this said he was able to, change his output from managing 10 to 15 patients to between 80 and 100 patients a day. And so that just goes to show the potential. And then, of course, doctors have always known that getting patients back into a social setting away from the hospital is the fastest path to recovery. And so if we can fully utilize remote monitoring and take full advantage of that clinical benefit, of course, it's very good for the patient, but it's a huge productivity benefit for hospitals at the same time.
Amit, in this virtualized care delivery model, how does a health system actually approach the technology aspects, and what challenges are they likely to encounter?
If you really think about it, you're essentially saying that rather than bringing the patient into the hospital, into the four walls of the hospital goes out of the four walls, essentially. And the care gets delivered at multiple points, right? It may be a clinic in the region, it may be at home, it may just be a virtual tele-ICU visit, irrespective of where you are. And essentially what becomes really, really important here is for us to be able to capture those moments and capture the information at every encounter that is happening in the patient journey. Because one encounter may happen at home, the other encounter may happen in the office, third encounter may happen in a regional setting, fourth encounter may happen at the main hub. And our ability to sort of capture those moments and capture those episodes in the form of the data, right, and be able to collect that information at the central location so that it can be analyzed becomes very important. So first theme here is data aggregation, right? So we have to be able to collect all of this information. But then you aggregated the information, and you hopefully will be able to aggregate information across your entire patient population. The data itself is no good unless we can actually layer it on top of it, technologies that can give us insight into that information. right? So, that becomes another important aspect of this, which is, can we collect all of that information, but then on top of that, can we then overlay, a technology so that you can actually get insights into it? And I would also say that, once you get the insights, applying those insights from the population and from the given patient into the actual clinical workflow becomes very, very important. So I would sort of point to what OHSU has done in Oregon, right? I mean, they have really been able to sort of do this distribution of care to a number of their regional clinics, be able to collect all of that information. More importantly, they've also been able to take the clinicians remote and be able to monitor their patients in the ICUs remotely. And I think that's given them significant amount of benefit. So it's something for us to sort of think about as to how care would be delivered in future. It's already happening, but I think the velocity of this is bound to increase.
Kiran, we just heard Amit talk about this layer on top of the data, and we know that this layer is usually a layer of analytical functionality or AI functionality to extract these insights. And that's our second theme, this notion that clinical medicine and data science have to come together to really transform healthcare. Can you say more about that part?
The entire body of healthcare data doubles every 73 days. And so then you think, well, the data science has to be a process here where we extract knowledge and insight from that data. And of course, today, a lot of clinicians are trying to absorb all of that and, run the calculations and algorithms in their heads. And that's based on their experience and, of course, their training and support tools. But what it does mean is that an awful lot of the data is never really used. And so by using data science techniques and analytics, AI, what we do is we mine those vast data repositories to really gain insight and drive better outcomes and also ease the total data overload that clinicians are facing today. And, if you look at all that data that the clinicians are looking at today, it's all historical data. It's data reporting on what has happened. And if I look at the 300 hospitals that are using our command centers, we take all the data in their hospital IT systems and we run applications. We've 38 AI applications, and it basically is able to tell the hospital what's going to happen in the future. And that puts them in a position where they can be proactive and take action to prevent, or accelerate or divert or adjust in some way to achieve better productivity or a better outcome. Mm. And so the AI discussion moves away then from debating the validity of such technologies and towards considering how do you implement and how do you drive the best outcome. And I think for health systems and clinicians, the technology itself that's not the end game. It's about getting better outcomes for patients.
Yeah, yes. And Amit, if in fact the AI discussion is shifting from debate to implementation, if you buy into that premise, what are the challenges and how do we see our way through the challenges of implementation?
Right. So there are, largely you can sort of categorize this into two buckets, right? Operational AI and operational efficiency solutions, and clinical AI and clinical efficiency solutions. In the US alone, there is $1 trillion of wastage that happens in the entire health ecosystem. Let's think about that number. It's a massive number, and there is a huge opportunity for us to sort of reduce that waste significantly. OECD has said that, in Europe, 20% of the total investment is pure waste, right? And I think that's the importance from an operational AI perspective. Now, in both these areas, there are 2 or 3 challenges. First and foremost, you can imagine because of the amount of data that is getting generated, there is a significant amount of AI development that is going to happen outside of every company in the larger ecosystem. And these AI algorithms, they need to be onboarded. And what that essentially means is if you have developed an algorithm using great amount of data, you basically need to be able to integrate that algorithm, right, in your system and in your clinical workflow. And it takes today anywhere between 4 to 6 months to actually onboard a third-party application or a third-party algorithm into a workflow. And there is a tremendous opportunity for us to simplify that process significantly by just defining interoperability standards, by defining good set of APIs, by defining a process by which these can be actually integrated quickly. The second aspect of this is workflow, right? Because in healthcare, for a clinician, you don't want the clinician to be swivel chairing from one application to another. And I think the seamless integration of these into their workflow is very, very important. There is a tremendous amount of data, but the challenge today is that a lot of that data is not curated. So it is actually like crude oil, right? And just like in case of oil, you take it through different stages of refinement, right? We also need to sort of refine the data, apply ground truth to it, make it interoperable so that it can actually be combined with other information. And lastly, what I would say is from a technology perspective and from a data science standpoint, there is a tremendous opportunity for us to use multimodal data sets rather than using a single modality data set, because you can actually combine the insights from one modality with insights with another modality and actually draw a much better inference and much more precise inference for the patient. And what it means is you need an enterprise-wide sort of platforming approach, right? You need to be able to create a platform that is virtualized, that is distributed, that is able to collect all of these data points and then be able to refine it.
Well, Amit, I want to stick with you for a minute because you led into this enterprise need. Our third theme is really enterprise-wide and network-wide surveillance. And we saw during the pandemic that regions and states or even hospital systems were trying to get a view across their entire network, if you will, as to what's going on. So when we talk about enterprise-wide or network-wide surveillance, can you kind of define what is the problem we're trying to solve?
You need to sort of be able to step back and look at the entire problem end to end, because a local optimization solution in a specific department may not necessarily streamline the entire pipeline, right? And our ability to get that surveillance at the system level, at the network level, right from the time the patient is being brought in to what is the availability of resources within the hospital, prioritization of patients in terms of who needs help first, making sure that those patients get the resources that they need. And secondly, we are able to really drive the outcome for those patients, which is critical, in a very timely fashion, right? Now, this requires, tremendous amount of visibility across all of these points of care across the system, starting with an ambulance all the way going into critical care unit. And secondly, our ability to sort of then combine that end-to-end information in a way that can really drive patient outcomes is important. And I think during COVID, what we saw is the value of this, because in command centers, you actually take different data streams from different points of care in real time, and you are able to combine that information to see the real-time picture of what's going on right now, where the bottlenecks are at this point in time that you need to remove so that the whole system can be unchoked, so to say. That has been extremely valuable, and we've been able to do this at the state level and obviously at the hospital system level itself.
So, Kiran, for those who are on the journey of transitioning to this data-driven health ecosystem that we just described, what are your advice or what are your thoughts that you can share?
We've had hospital CEOs remark to us that they've made more progress on telemedicine and digitization during COVID than they ever thought they would in the next 5 or 7 years. And so I think really what it has shown is the power of the technology to change people's experience. But of course, what it has also really exposed, and Amit referred to it in relation to the Indian experience perhaps, is that you need good infrastructure, and you need infrastructure like broadband or 4G or 5G in the future for these technologies to be democratized. We're in the business of precision health, and that's only going to be brought about if we really do a great job integrating and aggregating data from disparate sources. So if we do that and we stop the sort of fragmentation of data, the power is enormous. And I think we should feel really inspired by what's happened here. And I must say, David, I've never been more optimistic, really, about the opportunities facing us as an industry to dramatically change our ability to make more care available to more people around the world and achieve this goal of precision health. And it's the best example I can think of not fully utilizing a crisis really to make everybody wake up and think about how we can fully exploit what's available to us.
An optimistic future. Thank you. And on that note, we've come to the end of our session. Thank you to our audience for joining us. And thank you to our guest, Amit Padnis, Chief Digital Officer and Vice President, GE Healthcare, and Kieran Murphy, President and Chief Executive Officer, GE Healthcare. I'm David Seda.